Colonel Antarix. Have you ever heard of someone who sweats a blood? Not in a horror film, but in a real life. Yes, it is happened in a village. A 10-year-old girl brought to the Department of Secretary with a complaint of oozing of blood from her scalp. Yes, for the past 1 week, she has this type of case history. Her first bleeding started when she fought with a friend in her school. Punished by making her stand outside the classroom for an half an hour, and it was threatened to inform her parents about her behavior. Jade stood outside the classroom and cried out for an half an hour. Teacher noticed bleeding from her scalp and suddenly she informed her parents. Meanwhile, the teacher looked for any physical trauma has happened to her, but nothing was found. Any physical trauma has happened to the girl. Since then, bleeding occurred about 1 or 2 in a day, lasted for about 3 to 5 minutes from any part of the scalp. No associated pain was present, no history of any injury or happened to the any part of the body, or no intake of any drug or no air plugging was present. There is no bleeding disorder to her, and there is no any skin infection to her. Yes, she was suffering with a disease called hematohidrosis. In this condition, a person oozing or sweats of blood, history of bedwetting in a night for the past 2 years, about once or twice in a week, almost daily during the exam time and when the parents are scolded to her. She had a previously period of continuous for 5 years before the nocturnal aneurysm. Her father scolded her frequently, comparing her academic performance with her siblings. She's mother also doing the same thing and punishing her physically for the same reason. Almost every month during the result. Provisionally, the child diagnosed as a mixed anxiety and depressive disorders. She was started on a tablet, Impramine and clonazepam. Reassured and advised to come after a week for a review with her mother and father. During the next visit, the child was seated beside her parents and interviewed. She started elaborating that she was punished physically by her father for scoring 85% in mathematics, when suddenly red secretion was noted oozing from her scalp, as you can see in the figure. It was sent for biochemical examination, which tested positive for a blood with no other abnormalities. As you can see the report of the blood test. A skin underneath the bleeding side was normal, as you can see in the figure. No cuts, no abrasion, no tenderness is present. Bleeding stopped by itself in a minute. The pathology behind this case is the blood vessels around the sweat glands are constrict when the stress is happened. So as the anxiety increases, blood vessels are going to rupture. The blood into the sweat glands, representing as a droplets of a blood mixed with the sweat. The severe mental anxiety activates the sympathetic nervous system to invoke the fight or flight reaction to such a degree as cause rupture of blood vessels around the sweat glands. Thank you for watching the video. For more videos, stay curious. Thank you.